switch gears because it's kind of what the pandemic's all about. We'll catch up with the medical director from Public Health, Dr. Janna Manglona. Good morning, Doc.
Good morning. How are you all today?
Okay.
We're doing
How
pretty
about
good.
you?
Hanging in here.
It just got kind of hard to transition from homelessness to bright, sunshiny Dr. Manglona. Give me a minute.
I'm dodging radio and COVID.
Right. So, Doc, I guess, serious business now. And I know you spoke with Annette, I hope so. So what can you tell us about the status of all the different contact trace investigations that are going on with Department of Public Health in response to this latest surge of COVID-19 positive cases?
Okay. I want to say first off, because I think this is on everyone's mind, so far we've had, 20-some cases in the last week. None of them seem to be linked to the airmen, the 35, which that was good, which continues. We're past the window now, too. None of our cases. Now, I know that DOD has reported some cases, and because we're not involved with their public health investigation on base, I don't know if they are linked to anyone at their facilities. I wouldn't have any information about that. But
Doc, can I just get in? Sorry, just real quick on the DOD side. If there was an incident of positives that with a military contractor, would that be under the DOD side, or would that be?
They reported to us. We would at least know. They've had several cases recently, and they report to us. But as far as their contact investigation, they do it all internally, and the airmen stay on the base, or the sailors stay on base.
What about civilian people who work for a military contractor?
Those, they will do their investigation on base, and then we take it over from the Guam side of it.
So are you able to confirm if there were 3 positives that worked for a military contractor?
I don't know who their employer was. I know they've had a few cases this week, but I wouldn't know what their positions were.
Okay.
But I do know that one just recently arrived and was symptomatic, but I don't know what their position is.
Doc, because I had got a tip about 3 positives working for the contractor, and they were saying that, and I don't know, we can only ask, right? Trust and verify, that it was something about the water cooler. It was not, they didn't sanitize the water cooler. Is that possible or even accurate?
Well, okay, we didn't get that report.
Okay.
But I'm just trying to think in general what a water cooler might do. It could be. I've seen, I don't know, I won't drink out of water coolers myself because I've seen people, while I'm sitting at my desk, people go take their bottles and hook it on to that spout, and that's the bottle they just drank out of.
or they touch their face and then they touch the spigot to pour the water, right?
And we know that transmission occurs like that too. That's why we say wash the hands. So we know that's an easy way to get it. So I haven't heard that, but would it surprise me? Not in the least.
Okay. Mm-hmm. Okay. All right.
I wanted to ask you about the situation report because there was an increase in the positive cases on the military side, and there were 2 new positive cases aside from the 22 from over a week ago. And I'm wondering if you could provide us any information regarding that, because I did send something over to Joint Region Marianas. They kicked me over to Anderson Air Force Base, and I haven't heard a response from Anderson yet. But according to the SIP report, one of the positive cases was came from a quarantine facility.
That would probably, again, we don't get all of the details. We get the report, but they do their own investigations. But I did know that there was one. If they come from a quarantine, that generally means they just arrived on island and they're in quarantine, just like we do, waiting for symptoms and then testing from there, which is actually the best, because if people are brought in, and military or civilian brought in and quarantined, and you pick them up there, they haven't been allowed out. So that's actually a good thing. Better than somebody that's out and about and on the job.
Right, but the military's quarantine facility, do you know, for this particular case, if it's like at a hotel or... or on
They're
base?
quarantining on base. My most recent information, did it change overnight? I don't know. But my most recent information is they're doing that on base when it's just, I imagine if they bring in an entire group of people like before, I don't want to say an entire unit. I don't know how they do what they do. But if it's a large number, of course they're going to use the hotels on island. But if it's just a few, I would imagine they keep them on base, and certainly after they're positive, they're isolated on base.
Mm-hmm. Do you know if the military has any QFACs in local hotels? Or they're using any local hotels?
I don't think so. I think even when the Reef was involved, I don't think that was the facility that they used. I think it's just as not knowing how they do things, but I'm thinking that they see how many are coming and then they work it out with a local hotel at that point. Do they have ongoing MOUs? I don't know. Okay. But I know there's thousands that come to islands, and they always use the hotels for that because they don't have room on the base for that many people.
But we don't keep track of like where these deployed units, where they're staying or anything like that.
We're made aware, but they do their own monitoring, just like the Navy did when they used the hotels. They did that. They contained it themselves. Mm-hmm. And I would imagine after the success of Teddy Roosevelt and then what happened with this recent unit, I would imagine that it's going to be quite tight moving forward.
Right. Mm-hmm. And maybe I'm asking it wrong. Do you know which hotels are housing unit?
Here it comes. Go ahead.
Do you know which Do you know which hotels are housing military service members that are deployed to Guam, but are on restricted movement?
I don't, but that generally would go to someone else anyway. So it doesn't mean anything that I don't know that. To whoever they report to, that doesn't trickle down my way. It's something I could find out, I guess, if they release that information.
Mm-hmm. I just wonder if that's something that public health should know as we monitor.
Right. Yeah.
You know who's coming in and out of.
People would. That's not normally. It's things have changed a little bit. The reportable diseases from the military previously went to our territorial epidemiologist. But with COVID, everything's changed. So I was never in that line because it went to other people. Now with COVID, it's like all hands on deck, and I'm getting added to chat groups. I'm getting added to email, and because now it matters. Guam lives matter, and so now I'm involved in everything. And I'm like, I'm not in that loop. Where did you get that? But everything is having to be modified as we go along. So it's not that they're being secretive. That's just an email trail that I'm not in.
I see.
Doc, we were told that there was a connection between the recent positive of the Department of Corrections and the positive of the Guam Police Department. I think it was Dedito Precinct.
Yes, Dedito Precinct.
Can you give us any update on the contact trace investigation into the police department and the prison?
I haven't been made aware of a connection, but they will find one. They're always one part of what our team does is gets a really in-depth story from each of the patients, each of the COVID positives, and they track their movement. Then they grid this on boards, and they start drawing arrows when you see a pattern, and that's how we identify clusters. And we are finding less and less of a connection, an obvious connection. It's out in the community now. And so then there might be 2 or 3 from one facility, or so of course we look at that, but then you've got maybe 17 that aren't, and there's no obvious connection. So where'd it come from? We know it's in the community. So then we back up. If there's no obvious link that we can find, we continue doing our work and doing the contacts of those people, because now we know who has it. But we backed up and said, okay, what have we done? How has this happened? And I'll tell you where it seems to have started was when we lifted the restrictions on quarantine. Instead of going to the facility, which is tightly monitored, we permitted certain groups of people to go home and quarantine. And so do I think 100% of the people stayed in home quarantine? No, I do not. And I didn't think it before, but now we have people that have emergency releases from quarantine. They're able to go to funerals in the hospital, and obviously because people want to see their loved ones. But what do they do when they get in the car? And I know for a fact. Last week, I saw a breach myself, and had to report it, because what they do when they get in the car is we don't have much control over, and they have permission to go out to certain functions. But what happens at the function? I saw one. I drove by a Rosary last week, and I didn't see a single mask. What I did see, maybe 60 cars, people in the front yard, and I didn't see a single mask. So that's how it happened. And with public health, we keep drilling. Early on, it was like, yeah. Wash your hands, wear your mask. I'm telling you that quarantine and your mask, you're washing your hands, and just quarantining as you're supposed to. That's the best vaccine we have right now.
Right, yeah.
And so what started off as a yeah, now it's like, oh my gosh, that
Right.
is the only thing
It's
that works.
serious.
That's the only thing we lifted, and that's how it happened.
Right.
And I went back through the numbers yesterday and reviewed with the team, and I said, is this from the airmen? Isn't that funny? The airmen went out. I don't know. I heard they wore masks, and they went to socially distancing establishments, and you can imagine people there had masks on except for when they were eating. But if they're so far away, they were still at a reduced risk. But what happened? It wasn't airmen with known disease. It's Guamanians, our own people, not just Guamanians. It's our own people dropping the guard a little and getting a little comfortable because our numbers, went down so much. Our numbers went into our boots, and everyone started relaxing a little. As you can imagine, I mean, everyone does that. We've done it. We will be in an office and, oh my gosh, I don't have my mask on. Everyone's done it. We got a little too comfortable. And so no to airmen, but yes to our local population.
Can you tell us how many GPD officers have been tested as part of this trace investigation?
That I don't know. That's a nutty question. Okay. I know that they were doing certain pockets, like incoming travelers were being swabbed, and they will. I know that they will set up if they need to do a whole group, they'll just set up a location for that. And I think there's one that's coming up in Jigo that is specifically it's not open to the whole community. And I think a release was done for that. I was trying to find it this morning, but it wasn't on anything that I could get my hands on. But be careful when you go to a certain screening, because it may be for a certain group of people.
Right.
And
so
I don't want you to waste your trip.
Yeah. So when's the next mass testing that's going to be open to everybody, even without symptoms?
I'll have to get with Maddie. We did. Manila was yesterday,
right.
And they submitted 823 swabs.
Wow.
Which is a total record. Our poor team. I think they had so many cars in line at 11 o'clock, and this is maybe not the best intel, but they said no more, and there were like 250 cars at that point, and they actually finished after 4 or near 5, getting everyone done. But they'll be running those today. It's with that many, we're going to have to run some at our lab and use DLS as well. So I would look for those numbers to roll out over the next 2 or 3 days. And don't be surprised, we're going to find cases. And they may not be new cases, we don't know. But the more you test, the more you're going to see. So I expect to see the numbers to bump up a little, just from the testing.
Doc, so again, you're just imploring people to wear the masks and to practice the social distancing and the good hygiene.
That is the only thing that has worked in our quarantine. That's the only thing that has worked. And if we continue doing it, we'll stay at zero. I think those numbers were probably already floating around, or the positive cases were floating around, but we stayed at zero because everyone did what they were supposed to do.
Right.
And now that everyone's getting a little tired of it and a little complacent because, hey, we're not bad. And we have these numbers, but I think we still just have, knock on wood, but just one in the hospital.
Right.
So we're not, and that's a big metric for us. If we have 10,000 in Guam with any infection and nobody in the hospital, we can at least breathe a little easier.
Mm-hmm.
If we have 10 cases and all 10 are in the hospital, that would be a little frightening.
Doc, do you have any update on the DOC contact trace investigation? There were 5 officers, at least as we know, as of yesterday, that were tested. Do you have anything?
If they were tested yesterday, they came in with the 823. And I do know those will be prioritized if they're contacts. I don't have any results for you yet on that.
Mm-hmm.
But the hospitals always come first. Even if we do mass screenings, we still prioritize who gets run first. So I would look for those to roll out over the next couple of days.
Mm-hmm. What discussions are being made? Because the Physicians Advisory Group, you guys met last night?
We did.
Okay, can you provide us an update on what was discussed last night? Cliff notes?
It's not because it's a secret. It's because painfully for 2 hours, to be quite honest, we sat there looking at our protocols now for incoming travelers and where the hot spots are and who's a hot spot and how do we determine that. And oh my gosh, if we let our guard down here, then more of these are going to come in, and it's we're trying, and then we have something that's just beautiful. And Dr. Cabrera has just been phenomenal, and he must be so exhausted because he listens to everything we say and he tries to pin that for us and then present it, and then we all pick it apart, and then we had something that we thought was absolutely perfect, and the operationalization, long word, of that is going to be a bit of a challenge, trying to implement that at the level of the airport and customs and that sort of thing, because we can come out with a perfect plan, but it impacts so many people, and can it be done? I mean, do they have to fill out a 10-page questionnaire when they come through the airport? We see bottlenecks because we haven't had to do this before, and so what looks good on paper, sometimes when you start to implement that, it's met with challenges, and like, oh my gosh, we got to change again, and not having to do with the hot spots, but what can we actually do at the airport when they're coming in, and after they arrive, and testing after they arrive, testing before they get here. What's best? Because we said, a test would be great coming in. Well, great unless you're coming from Japan, where you can't get a test unless you're ill.
Mm-hmm.
You can't just walk in and get a test in Japan. So what? Those people can't come to Guam?
Mm-hmm. What about Dr. Cabrera? He was on earlier this week, and we were talking about home quarantine, and we brought to his attention one of our viewers about one of the protocols in the home quarantine guidelines, and that was allowing for individuals to go get takeout
Or
and grocery shopping.
But
and
we understand that policy is changed effective today. Is that accurate?
But I didn't see anything in writing.
I didn't either.
So.
I could get back with you on that. I haven't seen anything that came through this morning.
Okay.
But we have a meeting at 8:30.
But I mean, it's just interesting if you're on home quarantine. You talked about some allowances are made to go attend a funeral or rosary or whatever, but like we just let people go to the grocery store or go grab takeout. It just kind of seems counterproductive.
Well, let's talk about that a minute. They have to eat, and so I'll have to see if there's been any change in that. But they were permitted to get essentials. But another point is that quarantine is different than isolation.
Right.
And we don't talk about that much, but quarantine are people that may have had an exposure, and we're going to watch those people for 14 days for any symptoms, and they're strictly monitored. But the isolation are cases those are cases that are positive, and so they would not have that freedom.
Right.
But people who are in the government quarantine facility, are they allowed to leave to go get groceries or to go get takeout?
They're not.
No, they're not. Yeah. But I mean, Doc, you can see if you're on home quarantine because there may have been an exposure, and then you're out there gallivanting, and you give people an inch. It's just human nature. You tell them they could go get groceries, they go get takeout. Next thing you know, they're going to go to the gym, they're going to go here, they're going to go wherever.
That's what we've seen.
Right. Yeah. Exactly.
That's what we've seen.
And but we talk about the difference between quarantine and isolation. These are people in quarantine that we don't know if they have COVID because they haven't been tested, so they could be out there spreading it, right?
Which is exactly what I said.
Yeah.
We looked, and we've had a little surge of cases, and so we went back to see where it come from. And it's really easy to say, please God, let it be all those airmen, and then because that was so easy to explain and made us all happy to think, aha, there's the smoking gun. Well, it wasn't. So then we scratch your head and you go back, and then where have you been? What have you done? And the link to we strive to find the link.
Right, because when you look at the SID report, it indicates whether or not the new case had recent travel history, right? But then there are a lot of them I haven't seen where it says recent travel history. So how are we saying it's individuals that are in home quarantine?
Well, sometimes it's not people in home quarantine. What we have in the community was it people who were supposed to be in home quarantine and they went out, and we don't know. That's what they're trying to do, and sometimes you end up with a pile of papers and you just can't find that link. But we know that since we lifted and allowed for home quarantine, we have seen the cases come out. And now we can't prove it, but do the math.
Right. And so do you think that there's going to be any movement at all to change it?
We'll know more this morning because it's just hitting us now too with what the pattern is. But I think it might be a combination of maybe adjusting the freedom of movement. It may require testing at a certain day. We're looking at, like today, the traveler situation is in effect where there will be a different metric if you come in from a certain country and have had testing or haven't had testing. I think we have to, above all, stress to do what we were already doing, and because it works. And so we may have to just, really, really tighten the message that we send to the community to please do what you were doing before because it worked. We may have had a lot of cases out there, but we didn't know it because people were doing what they were doing, and we went to near zero. But then when it was relaxed a little bit, we've seen a trend. Is it due to that? It's looking like something like that has occurred. Yes.
All right.
Okay, Doc.
Gosh, we're not going to get rid of the test out, the 7-day test out for quarantine. Is that something that you guys are looking at getting rid of? Because that just went into effect today.
We'll have to see how that works. We'll have to see. Again, we take a step and then we see where we are.
Right.
And what we can do to mitigate that. So hold that thought. We're going to try it for now. And
give us a moment.
Yep. This probably won't change for a couple of weeks. Now, here's another thing. And that's for the inbound people. How many people do you think are going to come to Guam with what they're seeing on our numbers right now?
Right.
And also, on some reports, I was talking to the military yesterday, reports that they see include the ones from Teddy Roosevelt. So when you look at our case to population ratio, if you include all of those cases, which a lot of reports do through the DOD, of course they don't have any choice if they're sent here, but if I were in Japan, I would probably look at Guam and say, not right now. I don't think we're going to have I don't think we're going to be looking at a large influx of people. Plus, another layer to that is if they come here and stay for a few days and then go back home, a lot of these countries have mandatory quarantine upon their return. So you have someone sitting there going, wait a minute, I'm going to go for a few days. I have to do all this test. It's in a hot spot, which they might look at us as that, with our recent numbers. And then I'm going to come back and stay in a hotel in my own country for 2 weeks. Don't think so. Yeah. I just, whatever we do, I think we could say open up the borders completely, and we might have one person coming in.
Yeah.
Right.
I know you got to go.
Yeah, we do.
I just think 1/2 hour more, and
I'd be glad to do it at 9 o'clock.
You would not. You're lying.
I totally would. I'd give you an hour.
Yeah.
Bree's leaving early today, so I need the company.
That's the start for me.
Okay.
Well, keep you posted.
All
Thank you,
right.
Doc.
Thank you.
Right on.
Take home message: mask, wash the hands. I mean, those things have been effective. Guam, we just need to go back doing what we did before.
Right.
Yeah.
And there's only one in the hospital, so we don't have to pull the fire alarm yet, but we need to get back to business.
Right.
All right. Thank you, Doc.
Thanks.
Thank you.
Okay,
Bye.
take care.
Wash your